The first objective is to review frequently asked questions about data reporting. Next, we'll go over data entry topics, as well as tips facilities can use when navigating the NHSN application. At the end of the presentation, we will review resources on COVID-19 vaccination data reporting that should be helpful to facilities. Please note that today's slides have been put together by various members of the NHSN vaccination unit. First, let's start with going over some general questions. This slide reviews how to report cumulative COVID-19 vaccination data. To do so, facilities report the total number of individuals at the facility for that week. Of these individuals, facilities should report the number who have ever received COVID-19 vaccination at that facility or elsewhere since it became available in December 2020. It's important to not limit reporting to just individuals who are vaccinated that week. Instead, be sure to report the cumulative total of all individuals who have ever been vaccinated to date. So for example, 50 healthcare personnel received only dose 1 of the Moderna COVID-19 vaccine during the first week of reporting. During the second week, 5 more healthcare personnel received only dose 1 of the Moderna COVID-19 vaccine. Therefore, the facility should report that 55 individuals received only dose 1 of the vaccine by the end of the second week. Sometimes there are not any changes to COVID-19 vaccination data from week to week. In these instances, if there are no changes to your data, for example, there are not any changes in the number of individuals and their vaccination status, then simply report the same numbers as a previously reported week. However, please note that because there could be new healthcare personnel or residents joining or leaving the facility, vaccination coverage could change, even though no new vaccines are given. For instance, during week 1, 100 residents may be at the facility, all of whom received a 2-dose vaccine series. During week 2, 5 more residents joined the facility. However, these residents have never received any doses of the COVID-19 vaccine. In terms of counting healthcare personnel, facilities should report COVID-19 vaccination data on personnel who were eligible to have worked at the facility for at least 1 day during the week of data collection. This is regardless of clinical responsibility or patient contact. We've included a few examples to illustrate this. In the first example, facilities would count Nurse D in their data because she regularly works in the facility twice a week, Monday and Wednesday. John, a pharmacist, is also included in the data since he is scheduled to work in the facility each Monday, Wednesday, and Friday. Another question pertains to counting healthcare personnel who always work off-site, remotely, or out of state. These individuals would not be included in the data since facilities should only include those who are eligible to physically work at the facility. In the example on this slide, Caroline would not be included in the facility data since she performs all of her work remotely. It can be common for an individual to work in multiple facilities. In these cases, all eligible individuals must be counted at each facility where they work during the week of data collection. This is important since these reports describe vaccination rates among individuals working at a specific facility. So if an individual is scheduled to work at least 1 day each week at 3 separate facility locations, then that individual would be included in the data for each of the 3 facilities. In terms of reporting vaccination data, we received some questions on how to categorize individuals who received a COVID-19 vaccine that is not Food and Drug Administration FDA approved or authorized, for example, AstraZeneca. In these cases, individuals who received all recommended doses of a COVID-19 vaccine that is neither approved nor authorized by the FDA, but listed for emergency use by the World Health Organization should be counted in the unspecified manufacturer category, which is question 2.99, if they provide documentation of vaccination. Please refer to the CDC guidelines listed on the slide for the complete list of COVID-19 vaccines that have received an emergency use listing from WHO. Sometimes individuals are granted a religious or personal belief exemption to COVID-19 vaccination according to their facility's policy. Please note that an individual who declines to receive vaccination for any reason other than the medical contraindications listed in the CDC guidelines should be categorized as declined to receive COVID-19 vaccination for question 3.2. This is true even if your facility permits religious or philosophical exemptions for COVID-19 vaccination. This slide covers who is considered eligible for an additional dose or booster dose of the COVID-19 vaccine. According to the latest CDC guidelines released this month in October. Facilities should refer to the CDC recommendations to determine individuals who are eligible to receive additional doses or boosters after receiving an initial completed vaccination series. Those eligible to receive an additional dose or booster vary by factors including vaccine type, age, location of residence, underlying conditions, and occupation. So now we'll focus on a few questions we received about the NHSN application. This slide outlines points to consider when there is a change in facility administrator. NHSN highly recommends that if there is a change in the NHSN facility administrator, he or she should transfer that role to another user in NHSN prior to leaving the facility. If the previously designated facility administrator has left your facility before reassigning that role to another person, you will need to reach out to the NHSN Help Desk to have that role manually reassigned to the new administrator. You can request this reassignment using the facility administrator change request form using the link on the slide. Please do not re-enroll the facility in NHSN. After the help desk completes the reassignment, the newly designated facility administrator will be able to start the new user onboarding process. We also wanted to touch on a few points regarding Secure Access Management Services, or SAMS access. Long-term care facilities can currently access the NHSN COVID-19 vaccination modules with Level 1 SAMS access. Level 1 access is an interim measure with limited access to the application. Facilities are encouraged to obtain Level 3 access, as this provides more secure data upload. If your facility does not have a Level 3 user, please review the link on the slide to increase your access to Level 3. NHSN strongly encourages all facilities to have at least 2 users with the Level 3 access. So we'll now focus on how facilities should categorize healthcare personnel. There are 4 main categories of personnel that facilities are required to report on. Employees are defined as all persons receiving a direct paycheck from the facility. The second category consists of non-employee licensed independent practitioners, specifically physicians, advanced practice nurses, and physician assistants. The third category consists of students, trainees, and volunteers aged 18 and over. The remaining category is other contract personnel. Please note that facilities should refer to the tables of instructions for complete definitions of these categories before reporting data. You can use a link on the slide to access the instructions. So let's look at some questions that have been surfacing regarding employees. Facilities should include employees in the data who do not provide direct care to residents but meet reporting criteria. So for example, environmental services employees who regularly work in the facility each week but do not provide direct resident care are counted in the data. Front desk staff who are employees but do not provide direct resident care are counted in the data if they are eligible to work at the facility for at least 1 day per week. Please note that facilities should count healthcare personnel having official responsibilities in the facility, such as attending regularly scheduled meetings or required training. Some individuals work on a pro bono basis, or PRN. A few examples are listed here to illustrate scenarios on whether to include these individuals. So for example, if a PRN employee works every Tuesday of each week, then that individual will be included in question number 1 for the current reporting week. However, if a PRN employee is eligible to work once every 4 to 6 weeks, then this individual will not be included in question 1. This slide covers how to categorize employees who are on vacation or leave. Individuals should still be included even if they are on temporary leave during the week of data collection. Temporary leave is defined as less than or equal to 2 weeks in duration. So in example A, if Susan is on maternity leave for 3 months, then she should not be included in question 1 for the current week of data collection. However, John, the facility administrator, is on medical leave for less than a week. Therefore, he should be included in question number 1 for the current week of data collection. Now let's look at questions surrounding non-employees. The licensed independent practitioners category consists of physicians, advanced practice nurses, and physician assistants who are affiliated with the healthcare facility but are not directly employed by it. So for example, they don't receive a paycheck from the facility. That's regardless of clinical responsibility or patient contact. Post-residency fellows are also included in the category. Please note that advanced practice nurses include nurse practitioners, nurse midwives, clinical nurse specialists, and nurse anesthetists. This slide presents examples of individuals who are categorized as licensed independent practitioners. For instance, if a physician comes into facility A each week and is not paid directly by the facility, the physician will be counted in the licensed independent practitioner category. In turn, if an advanced practice nurse comes into facility A each week and is not paid directly by the facility, the advanced practice nurse will also be counted in the licensed independent practitioner category. The adult students, trainees, and volunteers category is defined as medical, nursing, or other health professional students, interns, medical residents, or volunteers aged 18 or older who are affiliated with the healthcare facility but are not directly employed by it, regardless of clinical responsibility or patient contact. Here are 2 examples of adult students, trainees, and volunteers who would be included in the data. Joe is an adult student who is not directly employed by the facility, but performs rounds on residents at least 1 day each week. And Carrie is a volunteer not directly employed by the facility, but performs clerical tasks at the front desk at least 1 day each week. The final category, other contract personnel, is defined as persons providing care, treatment, or services at the facility through a contract and who do not meet the definition of any other required denominator category. Here are 2 examples of other contract personnel who would be included in the data. In the first example, we see that Mary is paid through a contract. She works in the facility as a non-advanced practice nurse twice a week. Therefore, Mary would be included in the other contract personnel category. In example B, we see that John is paid through a contract as well. He works in the facility as a speech therapist once a week. Therefore, John would also be included in this category. This slide covers vendors or sales representatives. These individuals are not considered to be healthcare personnel, since their primary role is to sell a product or service rather than to provide care or services. Therefore, vendors should not be included in your summary data reports. So now let's move into the second part of the presentation on data entry. There are two main ways facilities can enter data. The first is to manually enter data into the application using the data collection form. The second way is to upload data through CSV files. For information about CSV upload, please review the guidance linked on the slide. We'll now go over some tips for data entry, focusing on the data collection form. Some facilities have received the error that the sum of individuals reported for questions 2 and 3 must be equal to the number of individuals reported for question 1. This error is generated when data are entered for questions 2 and 3 that are greater than or less than the total number of individuals reported in question 1. Specifically, the sum of individuals reported in question 2.1 to 2.99 and question 3.1 to 3.3 must equal the total number of individuals in question 1. It is important to manually sum the values entered for all fields in questions 2.1 to 2.99. The any completed COVID-19 vaccine series total that is auto-calculated by NHSN for question 2 only includes individuals who received a complete vaccine series. Since this does not count individuals with partial vaccination, relying on this total will likely result in an error. In this example, the user totaled the numbers in question 2.1 to 2.99 and 3.1 to 3.3 and can see that the numbers equal the total number of healthcare personnel in question 1. Therefore, an alert is not generated. But in this example, the numbers entered in question 2 and 3 are less than the number entered in 1. Therefore, an alert has been generated. A user will receive this error when the number of individuals reported in question 4 as being eligible to receive an additional dose or booster is greater than the total number of individuals reported as receiving a complete vaccination series. The total number of individuals reported in question 4 as eligible to receive COVID-19 vaccine cannot exceed the total number of individuals reported in question 2 as having received a complete vaccination series, as this is consistent with the eligibility requirements per CDC guidelines. An individual who has received a complete vaccine series has received dose 1 and 2 of the Pfizer or Moderna vaccines, or a single dose of the Janssen vaccine, or received a complete unspecified vaccine. This is auto-calculated by the NHSN application and displayed as any completed COVID-19 vaccine series. In this example, an error is not generated since the numbers entered for question 4 do not exceed the numbers entered in question 2. A user will receive this error when the total number of individuals reported in question 5 as having received an additional dose or booster is greater than the number of individuals reported in question 4 as being eligible to receive an additional dose or booster. Please note that the total number of individuals reported in question 5 as having received an additional dose or booster of the vaccine must be less than or equal to the total number of individuals reported in question 4 as being eligible to receive vaccine. Since question 4 and 5 are required fields, a value must be entered for each of these questions for the form to be saved successfully. If no individuals have received a booster or additional dose of the vaccine, a 0 may be entered for question 5 to save the form. So in this example, an error is not generated since the numbers entered for question 5 do not exceed numbers entered for question 4. We would also like to review how users should report all COVID-19 vaccination by manufacturer type. The NHSN application allows for vaccines by multiple vaccine manufacturers to be reported in a single data collection form. To enter data for more than one vaccine manufacturer, select a COVID-19 vaccine from the drop-down box. Enter the cumulative number of individuals who received only dose 1 of the vaccine. Next, enter the cumulative number of individuals who received both dose 1 and 2 of the vaccine. If some individuals received another type of vaccine, then return to the drop-down box and select the other vaccine, and then repeat steps 1 to 3 as described above. It is important that facilities view their saved data. Data can be viewed by navigating to the calendar screen on the vaccination summary data page. Records that are displayed in green are complete. Records that display in yellow are not yet complete. Users can select any of the green records to view or edit saved data. Users can select yellow records to enter data for that particular reporting week. Records that have been previously saved will display a date created, which indicates the date the record was first created and saved. The date last modified field refers to the most recent date edits have been made to the data in the data collection form. Line list data reports can also be downloaded using the NHSN analysis and reporting functions. To download data line lists, navigate to the Analysis tab from the left-hand navigation bar. Users will need to generate data sets prior to running a line list report to ensure the reports include the most up-to-date data. To do so, select Generate Data Sets, then Generate Reporting Data Sets. Next, navigate to Analysis and Reports. Please be aware that reports containing healthcare personnel data are saved within 2 folders: COVID-19 vaccination, which contains healthcare personnel data after the 10.0 NHSN application release, beginning with the week ending of October 3rd, and COVID-19 vaccination pre-10.0 for healthcare personnel data entered before the 10.0 application release. The next step is to select which report you'd like to run and select Run Report. A HTML report with the line listing of the healthcare personnel or resident data will be displayed. For more information about creating and modifying line list reports for COVID-19 vaccination data, please refer to the quick reference guide linked on this slide. NHSN regularly reviews data reported through the weekly COVID-19 vaccination modules to understand trends and to identify potential reporting errors. Data that were potentially entered in error are flagged by the application and displayed as a data quality alert on the application landing page. Users will see these alerts when logging into the long-term care facility component, or can access the alerts by selecting on Alerts from the left-hand component menu. A table with information about the quality assurance alerts will be displayed, including the reporting week, which form the alert is referring to, and descriptive information about the quality assurance flag that has been generated. Select the pink QA alert icon to view and edit data. A current data quality alert in the NHSN application generates if vaccination rates for a reporting week are less than or equal to 10% for the reporting week starting on March 2nd. This is calculated as the number of residents or staff who received any partial or complete COVID-19 vaccination series divided by the number of residents or staff in a facility for that week, excluding those not eligible to receive vaccine due to medical contraindications. For more information on how to view and clear data quality alerts, please review the following resource listed on the slide. Please note that there was a recent defect associated with this alert. However, it has now been resolved. So now we'll go over a few resources that may be helpful to facilities. Please use the link on the slide to access the COVID-19 modules and dashboards from the NHSN homepage. The long-term care facility component website contains links to a variety of training materials. The link on the slide will take you directly to these resources. You will also see a tab on the web page to access FAQs. CDC has created a tables of instructions document. This provides definitions for all categories and questions on the data collection form. Facilities should review all instructions before collecting and entering COVID-19 vaccination data into NHSN. If you have any questions about NHSN, please send an email to user support at nhsn@cdc.gov. Please include weekly COVID-19 vaccination in the subject line of your email, along with your facility type. This concludes the presentation.